Welcome back to Trauma Talks OTS 2026. Now let us learn from Praveen Mereddy. So my question is proximal humerus fractures. Do you trust Neer's classification for decision making?
Not really.
Varus fractures. How do you prevent collapse?
By adding a bone graft or valgizing the proximal humerus.
One situation where you would definitely not operate.
Elderly patient with a comminuted fracture and no dislocation, I would leave it alone.
One rule you always follow.
Yeah. After any intraarticular fracture fixation, I would mobilize the joint as soon as possible, and I'll ensure that I would get such a fixation that I can mobilize early.
One rule you broke and learned from.
I'm not a rule breaker. However, I have burnt my fingers, especially in acetabular fractures after fixing a posterior wall in an elderly person, primarily fixing it rather than replacing it. I have burnt my fingers, and that's why I would try and avoid fixing them if it is grossly comminuted in an elderly person.
One paper that changed your practice.
Stephen Perrin's paper on fracture healing definitely has changed my thought process about fracture healing in general.
One myth in trauma you want to bust.
Any fracture, the maximum displacement occurs at the time of injury. So I myself, when I had a base of fifth metatarsal fracture, I did not apply any plaster or a boot or anything. I started walking on day 1. I was back on the schedule for 6 weeks, and I've started following that. Patients are really good.